Have you ever imagined that with just your thoughts, you could control a computer, a robotic arm, or even restore the ability to walk after an injury? It sounds like science fiction, but Neuralink, a breakthrough technology founded by Elon Musk, is making it a reality. Imagine a paralyzed patient being able to communicate again, a person with Parkinson's no longer shaking, or an Alzheimer's patient being able to recall precious memories. This is no longer a distant dream but is gradually becoming a reality thanks to a tiny chip implanted in the brain. So how does Neuralink work? How can this technology change human life? And is it really the key to helping people overcome their own limitations? Let's find out in this video. Don't forget to like, share and subscribe to the channel so you don't miss the most interesting technology stories. Neuralink, a technological revolution that helps paralyzed people walk again? Have you ever thought that a completely paralyzed person could still walk and control his or her limbs with just his or her thoughts? This is not a miracle, but a realistic vision that Neuralink is aiming for. Neuralink is a small chip that is implanted directly into the brain, with microscopic electrodes thinner than a strand of hair. These electrodes are capable of connecting to nerve cells and recording signals from the brain. For people who are paralyzed due to spinal cord injuries or strokes, the main problem is that signals from the brain cannot be transmitted to body parts due to damaged nerves. Neuralink solves this problem by reading signals from the brain, then sending them directly to assistive devices such as robotic exoskeletons or prosthetic arms, helping patients perform movements that they were previously unable to. Animal testing has shown amazing progress. A monkey has been able to control a computer cursor with just his thoughts, opening up hope for patients who have lost the ability to move. In the future, Neuralink could help quadriplegics become more independent in their lives, even walking without the help of others. This means that millions of patients around the world could have the chance to live independently again, something that once seemed impossible. Brain chip implants, reality or science fiction? Could a tiny chip help paralyzed people walk, help people with Parkinson's control their movements, or even help people control machines with their thoughts? The idea sounds like it came from a science fiction movie, but Neuralink is making it a reality. The technology works by implanting a chip into the patient's skull, connecting to nerve cells via thousands of tiny electrodes. These electrodes can collect, analyze and decode electrical signals from the brain, then send them to external devices. What's special is that Neuralink not only records signals, but can also respond by stimulating certain brain regions, helping to restore lost functions. Neuralink's biggest breakthrough compared to previous technologies is its ability to operate in real time and the low level of invasiveness. While methods such as deep brain stimulation, DBS, or traditional brain-computer interfaces, BCIs, are often cumbersome and less flexible, Neuralink is designed to work naturally, helping patients interact with external devices without complicated interventions. If successful in humans, this technology could completely change the way we perceive the brain's capabilities. Can paralyzed people control the world with just their thoughts? Imagine a person who is completely paralyzed but still able to turn on and off lights, send text messages, surf the web or even work using only their thoughts. This is the vision that Neuralink is aiming for, helping patients with spinal cord injuries or locked-in syndrome to interact with the world more freely. Currently, patients who are paralyzed or unable to communicate have to rely on slow methods such as alphabets or eye-tracking technology. However, with Neuralink, they can use their thoughts to control computers or smart devices. This technology will decode brain signals and convert them into control commands, allowing patients to type, surf the web or even use robotic arms to perform daily tasks. Elon Musk has claimed that in the future, Neuralink can help paralyzed people type faster than normal people using a keyboard. If this becomes a reality, it will usher in a new era where even people with severe neurological damage can work, communicate, and enjoy life more fully. Neuralink is not just a technology, but a gateway to a world where disease is no longer a barrier between people and their dreams. Mind-to-mind communication. New hope for locked-in patients? Imagine being fully awake, aware of everything around you, but unable to speak, unable to move, unable to communicate in any way. This is exactly the situation that patients with locked-in syndrome face. They're trapped in their own bodies, helpless before the world around them. But that can change thanks to Neuralink. Neuralink has the ability to translate brain signals into text or speech, helping these patients communicate using only their thoughts. The tiny electrodes in the Neuralink chip can record signals from the language-related brain area, then convert them into written text displayed on the screen or even into an artificial voice. This means that even if patients cannot move their lips or make sounds, they can still talk to loved ones, doctors, or even use computers and phones. It doesn't stop there. Neuralink can also help patients control their surroundings. For example, they can turn on, off lights, adjust the room temperature, or control an electric wheelchair with just their thoughts. This is a big step forward in helping people with locked-in syndrome regain the sense of freedom and independence they have lost. If this technology is widely applied, it can completely change the lives of millions of patients around the world. No longer isolated, no longer having to wait for others to help, they will be able to control their own lives in a way never before possible. Help cure Alzheimer's disease and reduce chronic pain? In addition to helping paralyzed people and patients with locked-in syndrome, Neuralink also opens up new hope in treating complex neurological diseases such as Alzheimer's and chronic pain. Neuralink and Alzheimer's disease. Can memory be restored? Alzheimer's is a disease that causes severe memory loss, causing patients to forget loved ones and important moments in their lives. Currently, there is no method that can completely cure this disease. But Neuralink could change that. By stimulating and restructuring areas of the brain related to memory, Neuralink has the potential to help Alzheimer's patients improve their cognitive abilities. Neural signals can be reinforced, helping the brain relearn lost memories or at least slow down the process of mental decline. If successful, this technology could help millions of people retain their memories and maintain independent lives for longer. Neuralink and chronic pain. Eliminate pain without drugs? Chronic pain is one of the biggest problems that modern medicine has yet to completely solve. Millions of people around the world are living with pain from arthritis, nerve damage or cancer, seriously affecting their quality of life. Neuralink could directly interfere with the nervous system, helping to block pain signals before they reach the brain. Instead of using painkillers, which can be addictive and have many side effects, Neuralink could help patients manage their pain more safely and effectively. This would not only make patients more comfortable, but also open up a new direction in medicine, where people can actively control the feeling of pain, instead of relying on drugs. Neuralink is not only for patients with neurological diseases, but also has the potential to enhance intelligence and improve human learning ability. If you have ever wished for a super memory like in the movie, Limitless, Neuralink could help make it a reality. Enhance memory and information processing speed. By stimulating the areas of the brain related to memory and cognition, Neuralink could help people store and retrieve information faster. This could be especially useful for students, researchers, or people working in fields that require the ability to memorize and analyze large amounts of data. Imagine being able to learn a new language in just a few weeks, or memorize hundreds of pages of documents simply by downloading information into your brain, something that is currently only possible in works of science fiction. Neuralink could make these things a reality in the future. Brain-computer interfaces and the ability to control devices with thoughts. One of the most exciting applications of Neuralink is the ability to control machines and devices with just thoughts. Instead of using a keyboard and mouse, people could directly communicate with computers using their thoughts, speeding up work processes and reducing their reliance on traditional tools. This could change the way we approach technology and work in a variety of fields. From scientific research, medicine to creating art. For example, a musician can transform melodies in his head into music without ever playing an instrument. Or a programmer can write code just by thinking. We often think that the human brain has limits to its memory, processing speed, and learning ability. But what if there was a technology that could help you enhance your memory, learn faster, and even connect directly to the internet? Neuralink could be the key to unlocking that door. By connecting your brain directly to a computer, Neuralink could allow us to download information from a computer into our brains in the same way we copy data to a USB. This means that in the future, you could learn a new language, memorize textbooks, or even master a new skill in just minutes. Instead of spending years learning to code, you could download knowledge into your brain and start coding right away. But Neuralink could also help improve the brain's information processing speed, helping us think faster, make better decisions, and be more creative. This could be particularly useful in fields such as science, research, business, and the arts, where speed of thought and creativity are critical. If successful, Neuralink could transform humans into a super species, where intelligence and learning are no longer limited by biology. This would be not only a technological advance, but also a revolution in how humans access knowledge and expand their own potential. Technical challenges. What's holding Neuralink back? While Neuralink holds incredible promise, there are still significant challenges to making this technology a reality. 1. Device durability and stability. Since Neuralink is implanted directly into the brain, it needs to operate continuously and reliably in the brain environment, a challenging environment with complex electrochemical signals. If the chip breaks or needs to be replaced, surgery to replace it will be a big problem. 2. Optimize size and performance. Currently, Neuralink still needs an external device to process data, but the long-term goal is to make it smaller, easier to implant, and more efficient. This requires improvements in microprocessors, batteries, wireless connections, and how it communicates with the brain. 3. Human trials. A long way to go. Although Neuralink has successfully tested on animals, human trials are still in the early stages. Clinical trials need to be rigorously conducted to ensure safety, effectiveness, and no long-term damage to the brain. Neuralink may be the future of medicine and technology, but for it to become a popular product, the development team still has to overcome many technical and medical challenges. When a technology has the ability to read and control human thoughts, the big question is, will it be misused? Neuralink collects data directly from the brain, which could lead to the risk of personal information being leaked or misused. In a world where data has become gold, protecting brain data will become as important an issue as securing your bank account or online identity. Like many other advanced technologies, Neuralink may only be accessible to those with enough money to afford it. If only the rich can upgrade their intelligence and enhance their abilities, it could create a deeply stratified society between superhumans and normal people. If Neuralink can read and write signals into the brain, could it be hacked or manipulated? If an organization or government has access to your brain data, could they control your thoughts, behaviors, and decisions? This raises big questions about personal freedom and human rights in the age of brain-computer technology. Neuralink has the potential to change the world, but without strict ethical and legal regulations, the technology could become a double-edged sword, leading to unforeseen consequences.